The characteristics I've seen among the high performers is that they think outside the box, they're creative, they're willing to step outside the line and do something differently, and I think that's what's needed.
It really does take a different way of looking at what we do as a system and different ways of working together that allow for sharing of ideas, sharing of resources.
If you're going to improve the health of a person in your community or your community at large, it's a community-driven process.
The knowledge that I have learned in learning sessions and pre-learning sessions has been far and above anything that I have learned this far in my career. There are many high performers out there that are able to share many good techniques and tips that have helped.
This really is an opportunity to leverage the best of what we know and help to improve the care that's delivered right at the local level. We don't have time to become redundant. We don't have time to repeat or try to relearn what we already know. What we have time to do is to take what we know from all of our partners, pull it together, and put it to good use for the patients that are seen in healthcare settings across this country.
The Patient Safety Clinical Pharmacy Services Collaborative has really grown over the last 2 years. And what that tells us is that so many more people are realizing the benefit of integrating clinical pharmacy services into primary care.
We had never thought to engage our pharmacists and our pharmacy care staff with our clinical teams. Now that we're starting to put these together and making everybody else aware from an educational perspective, they're really seeing the light, and there are a whole lot of aha moments that we're seeing, and that was really the most challenging piece.
We could look at the clinical side and do something that's right clinically, but that it would also make sense from the business standpoint. And this PSPC has done that very thing. It has enabled us to do something good for our patients, good for our staff, and good for our team, but that makes excellent business sense.
If you work together with your partners and you can reduce hospitalizations, which many of the programs have, or ER use, you can reduce the cost in the system. And that those things are powerful. That says to funders, we can provide really good care and it can cost less.
PSPC's innovative approach to clinical pharmacy services is improving the quality of patient care, safety, and health outcomes. It uses the strength of multidisciplinary teams to enhance patient care coordination. It improves the quality of care, and more importantly, it improves the outcomes for patients. The FDA's Office of Women's Health is totally committed to this partnership. Together, we will demonstrate that government agencies can work together, that we will leverage our resources to maximize the impact for our patients and to improve the public health. So stay tuned.
We have had clinical pharmacy services available since 2001, but what the collaborative is really allowing us to do is something that we have never done before, which is actually collect data and report on data to show that what we're doing is really beneficial, hard numbers rather than just what we hear from patients and what we hear from our providers.
Results are so important in this quality improvement effort. The results are important at the local level, whether it's with 5 of their patients, 10 of their patients, or 200 of their patients. And then we're able to take those results from the local level and roll them up nationally to be able to tell our big picture story.
I've got a coworker who said, you know, without data, you're just somebody with an opinion. And really, if we are going to look at expanding these kinds of models across the United States, and of course, I'm with Communities Joined in Action, so we're very much about that, we have to have the data. We have to prove that what we say works really does work.
Motivating people to reach goals is always a hard thing. I think they need to see the benefit of it. They need to see the outcome of it. And what I've seen by working with my staff is that when they see what you can accomplish by doing a certain thing, by looking at a process and making changes to that process to improve it, or to just seeing that one patient and doing it just in a little bit different way, and they see a benefit from it, they're going to want to keep doing that.
In the last 11 months, our community teams have shown an improvement in health status for these high-risk patients of 56%. And that's 56% of our patients going out of control to under control in their health status, which is really just amazing. We've also seen a 49% decrease in adverse drug events for these patients that are on multiple medications, have multiple chronic conditions, and see multiple providers. And what leadership does is help us be accountable for the work that we're doing and to really help drive our teams towards success.
Really be part of the team that conducts the PDSA cycles, and to show them my support while not taking over the process, while allowing them to engage in their own process, come up with their own answers, and implement them.
Yes, we can take this to a new level, and we're open to learning, and I think that's where it starts. I personally, as the executive director, don't miss an opportunity to check in with them and say, how are you doing? Is the team meeting? Do you need any help with anything?
The clinical pharmacy is an expense, yes. We all know that. It's beyond the expense. It's beyond taking care of the patient. It's beyond what the needs of the patient are, and to make sure that the long-term effect is that the patient's receiving the best quality care and living longer because of the care that we provide them.
We have an opportunity to fundamentally change the way health care is delivered and paid for in this country, and it really does advance our mission to improve the quality of consumer health outcomes. Chronic disease is the enemy in this country, and if we are going to continue to prosper as a nation, we have to find better ways to address the plague of chronic disease.
The doctors helped me to see my problem, and I had like dizzy spells and stuff, so now I don't have that anymore. I'm working very hard at my health because I'm getting up in age, and I need to correct the things that I've been letting go past for so long. And they're the ones that's helping me out with the understanding of what's going on with the changing of my life. So I'm okay with that.